I'm Dr. Chloë May, and I'm a consultant clinical oncologist specialising in neuro-oncology at the Clatterbridge Cancer Centre.
I'm MacColl, and I'm the neuro-oncology clinical nurse specialist. Symptoms of a brain tumour can vary depending on the patient. The most common symptoms that patients present with are headaches, strange sensations in the arms or leg, or changes to the power and ability to use your arms or legs, visual problems, changes to your hearing. Sometimes family members can also notice things like changes in speech or changes in your personality.
It's really important, Jill, if people experience symptoms that are different for them, that they seek help. I know that brain tumours are extremely rare, thankfully, but that does mean sometimes people end up having a diagnosis later on. And what we really want to do with Brain Tumour Awareness Month is highlight that if you have any of these symptoms and there isn't another explanation, or you're worried and you don't think that they are just headaches, for example, then I'd suggest that you go back to your GP again. Yeah, so we treat a lot of different types of brain tumours here at Clatterbridge. We treat a range of benign tumours which are not cancer and some tumours which are cancer. Some of the benign tumours, the most common ones that we see are something called a meningioma and also a vestibular schwannoma. In terms of malignant tumours, the most common ones that we see are gliomas, and that can be the most aggressive type of glioma, which is called a glioblastoma multiforme, or it could be a lower grade tumour, a grade 2 or a grade 3 glioma. It's very much a team approach. So we have a really good team here at Clatterbridge of doctors like me, nurses like you, and a wider team. And we also work really closely with the surgeons, mainly at the Walton Centre. We have a meeting every week called a multidisciplinary team meeting where all of us get together once a week and discuss the cases that we need to. Often for the malignant brain tumours, the treatment is a combination of surgery, as I say, normally done at the Walton Centre, and then they come through to us at Clatterbridge for further treatment, which is often a combination of radiotherapy and chemotherapy, sometimes together. So, as I say, we're very patient focused, and we also want to help them in a holistic way. We're not just here to talk about what we see on a scan and which medication I can give you. We want to treat the patients as a whole person.
My role as a nurse specialist from an oncology point of view comes in as soon as the patients are referred to our service from the Walton Centre. Our first point of contact is to provide that support and reassurance after a devastating diagnosis. I think it's really important to remind our patients that we are there as a clinical nurse specialist in our area to manage their symptoms, to manage any concerns that they've got, but also to be their support network, their family's support network. I always say to my patients, the importance in all of this is their quality of life, and we are here to help them with that. I think raising awareness of brain tumours is incredibly important because it does help us promote the importance of an early diagnosis. And whilst for some of our patients it may not change the prognosis or the treatment plan, it does massively help with their pathway, with the psychological and emotional impact of their diagnosis and how we manage those patients and support them through.
I just feel absolutely passionate about helping people with brain tumours because it can change who you are, it can change how independent you are, and I just so much want to be able to help people in any way I can. And even if I can't cure their brain tumour, which sadly is the case a lot of the time, I can keep them feeling well for as long as possible.
I also have personal experience of living with and caring for a family member with a brain tumour. My experiences of going through that, as well as my absolute clinical interest in looking after patients with brain tumours. I am just so passionate about the importance of the care that they receive, not just from a medical point of view, not just from a treatment point of view, but what we can do for them and their families is so vital. We might not be able to change their diagnosis, we might not be able to cure their cancer, but we can offer them quality of life for the time that they have with their loved ones.